describe to me how the treatment for testicular cancer has advanced, starting wherever you like.
Before the chemotherapy era, a man diagnosed with testicular cancer would oftentimes have a physical exam, an ultrasound of the abdomen, and a chest x-ray. These were the tools to examine the extent of disease. The testicle would be removed, and patients would either undergo an operation called an RPLND, where the surgeon would remove lymph nodes in the abdomen, or they would undergo radiation therapy to their abdomen and oftentimes their chest. Because this is a disease of young men, the Walter Reed Hospital, a military hospital in the 1940s and 1950s for young men, they were seeing a tremendous number of cases of testicular cancer. So a lot of what we know about the early treatment of testicular cancer comes from the experience from Walter Reed Hospital. And they reported out their outcomes and complications from patients who...
There will be a Christian devotional and prayer service today in the University Hospital Chapel at 11 a.m. There will be a Christian devotional and prayer service today in the University Hospital Chapel at 11 a.m. All are welcome.
And
why don't you pick it up at what was learned from the Walter Reed Hospital work?
And so what they reported from, sorry.
I can still add to that.
Yeah.
Thank you for being aware.
What was reported from the Walter Reed experience was that if a man had seminoma and they received radiation therapy to the abdomen, the chance for recurrence was substantially less than if men had non-seminoma. And so there was a paradigm shift into how one was treated. If you had seminoma, you would have the testicle removed and you would receive radiation therapy to the abdomen and perhaps radiation therapy to the chest. If you had non-seminoma, you would have the testicle removed, and instead of radiation therapy, you would have an RPLND performed by a urologic surgeon. And then you would hope for the best. And if the cancer recurred, your only options in the pre-chemotherapy era were more surgery or more radiation. And those treatments are very ineffective in most men if the cancer recurs. Life expectancy at that point would have been a matter of months.
Excellent. Tell me about the discovery of cisplatin as a treatment option for these. How did that come about?
The discovery of cisplatin in some ways mirrors the serendipitous discovery of many chemotherapy drugs in the 1930s, 40s, 50s, and 60s. For example, the very first class of chemotherapy drugs that were ever discovered were the nitrogen mustard gas. And this was discovered during wartime when American seamen were exposed to this as part of chemical warfare. And Army physicians noted how sick they became and how their white blood cell counts were markedly suppressed. And so two physicians in secret through the government studied, they were Dr. Goodman and Dr. Gilman, studied this effect of this gas. And they came up with the very first chemotherapy drug that was ever tested in human beings, again, against cancer, and that was nitrogen mustard. In the 1950s, the anti-folate drugs were also discovered serendipitously. There was a pathologist in Boston who noted that if folate was added to a petri dish with leukemia cells, the leukemia cells actually grew more rapidly. So he developed a drug which was actually an anti-folate, which caused reduction in the cancer, and the first children with leukemias were tested with this drug, and temporary remissions were noted. So the serendipitous discovery of drugs was not all that unusual in the day. Cisplatin is a wonderful example of this. In 1965, there was a biophysicist at Michigan State University by the name of Barnett Rosenberg. And Dr. Rosenberg was studying the effects of an electrical current on cell division in a bacteria called E. coli. And he proposed that perhaps you could kill cancer cells with an electrical current. So he set up an experiment with a water basin. He put the E. coli bacteria within the water basin. He put two electrodes, and then he sent an electrical current from one electrode to the other, and then observed what had happened. And what was very interesting was that the E. coli cells stopped dividing, but they continued to grow. And so he repeated the experiment multiple times to understand what the variable was that led to the cells stop dividing. And it turns out it just happened to be the platinum metal of the electrodes. And so he published that in 1965 in the major journal Nature, and history was made at that time. The first human studies of cisplatin followed some animal studies that were done in the late 1960s. And the first human study was done and reported in 1971 from Roswell Park in Buffalo, New York. And that's where the observation that several men on this study with testicular cancer had tumor regression by giving them cisplatin.